The self-awareness. This is a process where a nurse must recognize her own feelings, values, beliefs, and everything about her, like the thoughts, the motivation, the prejudices, the strength, and attitudes. This is necessary in order for the nurse to discover herself before helping others. It will allow the nurse to observe and pay attention, and the most to understand even the subtle responses and reaction of the clients when interacting with them. In the nurse client relationship, self awareness is a must. Having mentioned several principles involved in the definition of self awareness, we will pick three of the most important concepts. And these are what we call the values, the beliefs, and attitudes. All of these principles will guide the behavior of a nurse in defining self-awareness and in dealing with the patient. Let's first talk about the values. Values are abstract standard. This is best defined by the code of conduct that we follow, or if you still remember when you were young, the GMRC, the good morals and right conduct. By this means, you are able to sense what is right from what is wrong. And some of the most common examples of values are honesty, sincerity, faithfulness, and orderliness. In our next discussion, in the next slide, we will deal further with the greater details of what values is all about, particularly if we want to clarify the process, values clarification process. We will have to go through steps of choosing, pricing, and acting. Let's proceed with beliefs. Beliefs are ideas that one holds to be true, and these beliefs are greatly affected by culture and some by religion. Now, when we speak of beliefs, primarily these are opinions that is being held by the majority of people. You may wonder, some beliefs are rational, but some are irrational. Be it rational or irrational, at times they are supported or even contradicted by an empirical evidence. And an example given here is that an old people are hard of hearing. That's what he believes in. Failure is a learning process. These are some of the beliefs. Experience is the best teacher. These are beliefs. And another last example here, if the sun is shining, it will be a good day. Finally, we have the attitudes. Attitudes is still another principle that will guide the behavior of a nurse. When we say attitudes, these are general feelings or frame of reference from which the person will organize his knowledge. Now it will entirely define what a person is, and it will color the personality or behavior of a person, such as whether a person is either hopeful, either a person is optimistic, or on the negative aspect, he's a pessimistic. Or how do you want to be identified? Are you a positive person or a negative person having this mental setup? Attitudes, beliefs, and values needs to be assessed by the nurse. The nurse must reevaluate and readjust all of these principles mentioned, and this must be done periodically. As you gain your wisdom and experience, then you will learn sooner that self-awareness and dealing with the patient will need reassessment of your values, beliefs, and attitudes. The values clarification process. After having mentioned of several principles involved in self-awareness, then we have discussed values as one of the principle that will guide the behavior of the nurse in shaping herself when dealing with the patient. Now, values clarification process will have to undergo three processes, and these are choosing, pricing, and acting. Now, in the very first step, if you may see in the picture, there is the nurse here trying to self-search and do the self-awareness process. And in the process, he is going to undergo values clarification process by stepping into the ladder. Choosing the values would mean you will be confronted with several possibilities and ranges of values. And to give you some example, there are basic core values that we have to accord ourselves. These are integrity, respect, responsibility. Of all the range of this possibility, you will have to choose freely. What do you value most? And what do you feel is right for you? Let's say, for instance, you choose being responsible. Then the second step would be you have to prize it, meaning you have to cherish it, meaning you have to embrace it, meaning you have to attach it to yourself publicly. So that simply means you have chosen it, you have prized it, and that will define your behavior and that will define your personality as well. Now, the last thing that you have to do in order to clarify your values is the last part, which is acting. This is walking the talk. That means when you have chosen your values out of the many, out of the range of possibilities, then you have cherished it, and then the last thing is you have to walk your talk and do it. Put that values into your action, and people will see that you are a one responsible person as you chose being responsible as the values. And this is what they call the values clarification process involved in self-awareness. In your venture as a student nurse who will soon become a professional nurse, and in your dealing with psychiatric nursing, you may ask the question as to why do you need to become self-aware? And this kind of question is soul searching, and these are the possible answers that you may get. Definitely, you want to improve your performance and you want that goal, that particular appropriate goal. And of course, you want to manage yourself and have that appropriate career, which is, of course, your nursing career. As well, you want to become self-aware because you want to develop the interpersonal skills. Important skills not only for nurses, but all of the professionals. And specifically in psychiatric nursing, you want to understand the behavior of others, their differences that may exist between one person to the other person. And finally, when you know how to become self-aware, then you know how to manage your stress. And as well, you will understand why do other people react the way they do. Even they sometimes they know that they're wrong, or sometimes they know that they're right. And of all, having said all of this, you are to adapt your communication to the needs of others. That's why you have to become self-aware. The therapeutic use of self. This is in a way abstract. This is the nurse's therapeutic use of self, a term that will encapsulate the nurse's role in working consciously with the interpersonal side of the nurse-client relationship. And this is being done in order to facilitate an optimal experience and an outcome for the client. Now here, nurses will use themselves, and they are not only an individual, but they are a therapeutic tool in the profession. They will establish that relationship to the client, and this relationship will grow, it will change, and it can heal the patient. Now, in the therapeutic use of self, definitely you will use your God-given talent, and this will include your personality, your experience, your values, your feelings, your intelligence, which is the most, your coping skill and your needs and your perceptions. And these are all embedded in a relationship that the relationship will be beneficial to your patient. Your personal action will arise from your conscious and unconscious responses. and you are going to heal a patient, and you will become an important component of the society where you live in, because you're sharing your life experiences, your education, your spiritual and the cultural values in you. The therapeutic relationship and its phases. In therapeutic relationship, the nurse uses communication skills, the personal strength, understanding of human behavior. This is in order to interact with the client. And there are parameters. The basic parameter would be the focus of this therapeutic relationship is on the patient. This has been defined by Peplo, and she wrote about the interpersonal processes 35 years ago. And she created or delineated the phases of a nurse-client relationship. Hildegard Peplo is one of the theories for interpersonal relationship. Her work provides the nursing profession with a model, and this model was used in order for us to understand and document the process that is involved in interpersonal relationship. Peplo's model, 1952, has three phases, and these are: number one, the working; second, the orientation, rather; second is working; and the third is the resolution or the termination. Orientation is the first part of the nurse-client relationship. During orientation, it is necessary that the nurse and the client must arrive at a nurse-client contract. This nurse-client contract can either be expressed formal or informal. It is said to be formal if it is written, and it is said to be informal if it is verbally executed. Within the contract, it is necessary that both the nurse and the patient must maintain confidentiality, and on the part of the nurse, she must at least consider self-disclosure, for this can gain the trust of the client. And finally, it is also the duty of the nurse to warn any individual or any organization from where a threat can emanate from the client. The orientation phase will begin when they meet each other, and it will end once the problem has been identified. The following are the nurse's roles, or the following must be established by the nurse, such as her role and the role of the patient. She must also clarify the purpose of the meeting and the parameters of not only the present meeting but the subsequent meetings and other meetings. She must identify the client's problem, and she must clarify the patient's expectations. This is the first phase of a nurse-client therapeutic relationship, known as the orientation. Having mentioned about the contract between the nurse and the client, as having discussed that the contract can either be formal or informal, formal if it is written and informal if it is verbal. The contract should contain the following. One, it should state the time, the place, and the length of sessions. Second, there must be a clear and concise duration. The sessions, the number of sessions that the nurse will come, when will they meet, how often they will meet, and it must be clarified that it will come to an end, or what we call the termination. That is in order for the patient to be pacified if there will be a separation anxiety that can happen when the nurse is about to end the meetings or the sessions. Also, it is stated in the contract as to who will be involved. Will it involve other people other than the nurse? And it will also clarify what are the responsibilities of the patient or the client, as well as the responsibilities of the nurse. These are the content of the contract that must be agreed upon by the nurse and the patient during orientation period. The working pace, the second step, and a pace after orientation. Working pace is said to be the most intricate part of the patient or the nurse patient therapeutic relationship. There are two sub-phases involved here. One is the problem identification, and the second is exploitation. In problem identification, it is clear that the nurse must come up with the issues or the concern of the client regarding her problems. If you may look at the picture, the nurse is communicating to the client and they're now doing the working pace. The second sub-phase of working pace is called the exploitation. Now, during the time of Peplo is one of the theories and one of the pioneer who works on relationship of the patient and nurse. Peplo used the word exploitation. This was first defined as the unfair using or taking advantage of a person or a situation. That is an intense exploration and elaboration to examine the problem and work on with the problem. Exploitation is defined here as when the nurse guides the client to examine the feelings and responses. Then later, they will develop a better coping skills once the nurse have examined the feelings and the responses. And there will be creation of a more positive self-image. Now, working pace is responsible or primarily geared towards intense exploration and elaboration of the problem. There are tasks that must be accomplished in this space, such as maintaining the relationship, to get more data as much as possible, to explore the perceptions of reality is one of the specific tasks, and developing a positive coping mechanism for the client, as well as having self-concept, positive self-concept. It is also the task of the client to allow the client to verbalize her feelings. That is in order for her to have a behavior change. And the nurse must work even though there is a resistance. They must both work through resistance. And in the end, the nurse must evaluate if there is a progress. And if there is just a little progress, then there is a need for redefining the goals again. And then the client will now practice a new behaviors. And this behavior will become a promotion of independence. So the client will really have a change in behavior after going through the sub phases of a working pace. Now, in a working pace, there are two important terminologies that we have to consider, and these are transference and the counter-transference. Transference is happening to the client unconsciously when, from the word itself, the client will transfer, okay, to the nurse the feelings that she has with significant others. And one of the concrete example of transference here is that when a client is either annoyed or is either irritated to any person that she happens to meet before, like the person in authority, such as a teacher, a principal, a supervisor, And in the process, during the relationship of patient to the nurse, it is possible that that the patient may also have the same feeling to the nurse as she is annoyed or irritated to a person in authority, which in this case is the nurse. Likewise, in the case of the nurse, it is also possible for the nurse to respond to the same emotions and same feelings of transferers, and she will do it by counter transference. The nurse will respond to the client based on personal unconscious needs and conflicts. So it is possible also that the nurse may get irritated or annoyed with the patient in return. That is why it is being said here that self-awareness is very important for the nurse in order to realize what and how is the accomplishment of a task going on during the working phase, and what direction are they going through. And this is what we call the working phase. In the working phase of the patient-nurse therapeutic relationship, the nurse must come up with the following task or accomplishment of the following task. One of that would be she must continue to gather more and more data about the client. That means she needs to explore even the relevant stressor of the patient. As you may look at the picture, it's not only the physiological data that she must gather, but as well in the process of working phase, she must explore more and more information regarding the client. She must be able to promote the patient's development of insight and some other constructive coping mechanism. And most importantly, the nurse must be able to facilitate a behavioral change. And this behavioral change will encourage him to evaluate the result of his behavior. Furthermore, the nurse must provide opportunities to the client for him to have an independent functioning so that the client can decide on his own, and the client later on, or either the nurse can evaluate the problems and the goals. And if the goals are not yet met, then they have to redefine. The termination phase. This is also known as the resolution phase, or simply the final stage of a nurse-patient therapeutic relationship. This begins when the problems are resolved, and it will end when the relationship is ended. Now, the goal of this phase is to bring the therapeutic end to a relationship. However, the nurse and the patient do have both feelings about the resolution of this stage, especially to the patient. It is considered, the patient will always consider this as an impending loss on her part. And in the process, the patient may act out. She may act angrily as if the problem has not been resolved. And she may bring back some old resolved issues. But take note, the nurses must consider this as a stalling maneuver. And instead, the nurse must refocus the client on a newly learned behavior or skills that is in order to handle the problem. This is the termination, the last and the final stage of a patient-nurse therapeutic relationship. During the termination phase, the following are the tasks that the nurse must accomplish. The nurse must establish a reality of separation, that their meetings must come to an end. The nurse must review the progress of therapy and, of course, if the goal has been met. And the nurse must be able to formulate plans for meeting future therapy needs. And finally, both the nurse and the patient must mutually explore the feelings of rejection, the feelings of loss, the feelings of sadness, anger, and related behavior. It is being said that all advice in any form is a hurting feelings. And these are the tasks of the nurse during the termination phase. The boundaries in the nurse-client relationship. It must be understood that the nurse has the power over the client, and that is obvious. This is because of the virtue of the professional role that the nurse is playing. But the power that the nurse have over the patient can be abused for a reason that there might have been on an excessive familiarity, or simply saying they might have an intimate relationship. And this is if confidentiality is being breached. In a nurse-client relationship, there must be a professional boundaries that outline expectations for appropriate relationship. They must maintain these professional boundaries. This is in order to ensure that they can meet the therapeutic outcomes. The nurse must act warmly and empathetically, but must not try to be friends with the client as much as possible. And professional boundary concerns include issues that is associated with self-disclosure, gift giving, a touch, or friendship, or a romantic association. Having defined the boundaries of a nurse-client therapeutic relationship, the nurse may be able to distinguish if they have breached that boundaries by looking into the warning signs. When we speak of warning signs, this will be an indicator for a professional boundaries that is already in jeopardy, meaning there's already a transgression of the professional boundaries. The following are the warning signs. One, if the nurse will favor one client or the client's care over another, it is obvious that there is already a warning sign. If the nurse is keeping secrets with a client, it's a no-no. Changing dress style for working with a particular client. Wow. Swapping a client assignment to care for a particular client. Spending free time with a client. That seems obvious, especially if you are receiving gifts or continuing contact with the client even after the discharge. Giving special attention to one client over another, special attention. This is what is being mentioned. And frequently thinking about the client, even when they are away from the work. That must be something else. And sharing information with a client. All of the mentioned situations are warning signs, and this warning sign may endanger the nurse-client therapeutic relationship in the process.